I think there are a number of key things where REACH really comes into its own. One of the big things is the language barrier isn't there. The counsellors, most of them are bilingual and trilingual, and they can speak to the clients in their native Punjabi and Urdu tongues. This is a massive help in terms of engaging with the patients, because what I found is patients like to speak, especially when they're talking about mental health difficulties in a tongue that they're familiar with and that they find easy to speak in. So the fact that the counsellors are bilingual, trilingual makes a massive difference, and is a key kind of selling point of REACH. The fact also that the patients don't have to travel and they are in a familiar environment within the surgery is also very helpful. That this is a place which they know, they trust, and not having to travel long distances to access the help that they need is also helpful. A lot of the patients that I refer are women and they don't drive, so having the counsellors actually come here to the surgery and being flexible in their timings as well is really helpful. It's not a 9 to 5 kind of like rota that they operate here. We've got some counsellors coming in during extended hours during the week. Some come in later on as well at 5:30 or so, and they really go out of their way to accommodate the patients, and I think that's very, very helpful.
Hi, my name is Leanne Tagizadeh. I'm a counsellor and supervisor living and working in Glasgow. For REACH, I do group supervision once a month, normally for an hour and a half, and that depends on how many trainees we have in. And also in terms of REACH, I might do assessments for uni for the students and some consultation with the staff at REACH. I also do private practice. I work for NHS as a counsellor and also do supervision individually and groups elsewhere. My experience of REACH has been extremely positive from the start. They sought me out in terms of offering some supervision and asked my views in that in terms of the organisation and the needs. Very forward thinking, thinking about training for the students, the counsellors within the team. In terms of organisation, I know they do lots of outreach work, lots of consultation with NHS, government, which is absolutely ideal for funding, great for future, for securing the service as a whole. In terms of the counselling service, again, very inclusive of the local BME community. The trainees and the counsellors in place have a very good, I think, training in advance, induction, to help support that service. And some people have more background experience with BME than others, but very much there's support at the start for the trainees. Lots of kind of on the ground work that gets done to check out need, sustainability. Lots of links with local GPs, and that's obviously ongoing work. So extremely supportive, very inclusive, and lots of consultation, which then affords change further down the line and can only be a good thing to expand in the future.
In terms of where REACH fits in the overall picture of mental health service providers here in Glasgow, it's definitely got a niche market in between the primary care mental health team and general adult services. There is a gap there which you can utilise for the patient's benefit. If they're from a BME background, language is a particular issue, or the patient doesn't want to travel particularly far, then REACH are filling that gap, and there is definitely a void there, which I could see from my own practice. When I started, it was very difficult to try and get services which were appropriate for some of our patients who needed counselling for their mental ill health services like CBT in their own native tongues, but it just wasn't available. This is something which REACH are now providing. There is a demand for it, as is being shown by the amount of referrals that we're doing, and I believe that there will continue to be a demand for these services.
The first time I had came across and heard about Reach was actually with a client that I had a couple of years ago. This particular lady had a chronic pain issue, and there was also quite significant issues ongoing with her mood. Various different things at the time that I felt were contributing into the pain problem. Okay, I think one of the most important things that Reach offer us as clinicians is the counselling service. We're very aware that pain isn't just a physical experience. There's a lot of social, affective, motivational components that are related to a person's pain problem. Obviously, as clinicians, we have certain skills, motivational interviewing, we can offer them informal support, but our skills are limited and we can only take that so far. It's very important that we have organisations that we can tap into when we need additional support in helping that patient with their pain problem. Obviously in the south of Glasgow we have a lot of patients that English isn't their first language, so I think it's really essential that we have an organisation like Reach or similar where they can offer that support to us, that service for the person.
One of the things that obviously will come up for the trainees and the counsellors is potential language barriers, cultural differences. Certainly the trainees and the counsellors within Reach come from, again, a good diverse background, so I think that's definitely helpful for the service. If somebody can have counselling in their own language, if that's their preference, that's absolutely key, because I don't really know other services that can offer that, certainly not to the same extent. I think the fact that there's, if a client would wish it, culture specific, religion specific, language specific counselling, that would be absolutely ideal. And if they don't choose that, that's okay, but the fact that there is a choice and lots of services, and as good as the interpreting services in Glasgow can be, from my own counselling experience, it's absolutely ideal if there's a language affinity, or just for a client to have that choice. That's absolutely the key, and Reach does that particularly well.
All these years I have been working with bilingual children. I noticed that there is a bit of a shift in the nature of issues, concerning whether it's depression or mental health in general. From minor things like frustration of trying to learn a new language and a new culture, to fit in a new culture, a new context, to the bigger issues like kind of fleeing suddenly their own context because of war and loss as well of their relatives, and separation and all of that, and that can be really too heavy on a fragile young person. A young person who's my students, she had a lot of problems, and then she approached me and she asked me for help. She wants to see somebody to help her with her issues. And I knew there is some trauma there are some issues, but I wasn't in the best place to help her with anything. But all I could do is to find a proper, appropriate agency to help her.
I think one of the things that has really struck me about Reach, the organisation, is that a lot of the things that it offers, such as the counselling, employability issues, exercise, general health and well-being, these are things that are paramount to us as physiotherapists. We absolutely know that a person's mood, for example, particularly in the chronic pain context, can absolutely influence and cause them pain. We have to help them with that.
Reach, they have that extra, because they have the awareness of the cultural awareness, and they have that experience for all these years to deal with their clients or their patients as individuals from different contexts. So they don't do the stereotyping or the blankets or guessing, because it's very important that the cultural awareness goes hand in hand with the counseling, because even the body language can be read wrongly, during a meeting. So I think that in that sense, Reach would be more beneficial to her than any other service, I think.
I think again this is why it's really essential that we have the help of organisations like Reach, and I would particularly envisage that and hope that the kind of networking between Reach, other organisations like it, and our chronic pain services here, I hope that grows, because I certainly think that that's a partnership that's worth exploring if we're going to try and help and improve the services that we offer for all of our patients.
I suppose other things that are important to highlight about Reach are, one of the big ones would be sustainability, because there's lots of really good things happening now. There's definitely growth, there's definitely expansion in the research that gets done, and all those things can only continue if there is going to be funding, and it's difficult to work in a place where you only have a certain deadline of funding. The absolute ideal would be a bit like NHS, where there just is regular ongoing funding for psychological therapies. If Reach could have something that would sustain that.
The patient feedback that I get, it's almost universally positive, and has been, and that's reflected in fewer consultations here in the surgery. A patient who's coming every 2 weeks, you don't see them for months at a time. So there's very much as a kind of effect on their behaviour in terms of attendance, and there is also a positivity in the way they describe their own well-being as well. So they do feel better. And there have been some quite tricky customers which I've sent along the way of Reach, and like I say, almost without fail, they've dealt with it in a very professional manner, which has been non-judgmental, has been culturally appropriate and sensitive to the person's background. I think very much there is a need for a service provider such as Reach within Glasgow and beyond. The black and ethnic minorities are very much a part of the fabric of society here, and will remain so for the foreseeable future. And for such a segment of society, having a service there which addresses their needs in terms of mental health is to be welcomed. It's something which I was looking to try and get something like this a while back, and I'm delighted now that Reach are there to try and fill that void.